It is time now to again put a doc on the clock. Did you know today is Sweetest Day? Though for some women, this day will hit a sour note. Dr. Sheryl Kingsberg is joining us to talk about this right now. Thank you so much, Doctor, for joining us. For a lot of women, this day is not a happy day. Explain to me what hypoactive sexual disorder is.
Well, Ramona, it's so great to be here because while it's true that millions are going to celebrate Sweetest Day, there are millions of women who are suffering from this condition, which we call hypoactive sexual desire disorder, which is the loss of all sexual interest. It's missing the wanting or the appetite to have sexual desire, even though somebody might be in a very otherwise happy relationship. So the problem is, number one, it's hard to say, so we shorten it to HSDD. And secondly, women do not know that it's a real medical condition. So they think, A, they're the only one in the world, even though there are millions suffering from this condition. It is the most prevalent sexual problem for all women of all ages. And two, they have no idea what they should do to treat it. They don't know where to go.
Well, how do you know if you, in fact, have this condition? Because sometimes maybe women just don't have a sexual desire because they're obviously ill or menopausal. Or what are the symptoms? How do you know that something is wrong?
Sure. That's a great question. So when we think about the real condition, this is the persistent loss of all sexual interest, the wanting to have sex, that is not otherwise better accounted for by having a medical condition like depression or diabetes or some major illness, or it's not caused by a terrible relationship, right? You could have all the desire in the world, but if you're not happy with your spouse, then that's not hypoactive sexual desire disorder. But on the other hand, what I see more often are women coming in saying, everything in my relationship is great, but I've lost my appetite for sex. And if I'm not able to get that back, I think I may lose my relationship.
Wow.
What we know clinically is that when sex is good, it adds some value to a relationship, maybe about 20%. But when sex is bad or non-existent, it is inordinately powerful, draining that relationship more like 50 to 70%. So as we're trying to look at why divorce rates are so high, for example, one of the problems is that sexuality and sexual problems really drains a relationship. So on Sweetest Day, millions of women are wondering, how can I get help? They should be going to their primary care physician or nurse practitioner, their OBGYN, and saying, I've lost my sexual interest. What can we do about it? You want to tease out, is it psychological? And you send them to somebody like me who's a psychologist. Or is it biochemical, sort of like depression, maybe both? And we have some treatment options. There's one approved drug for treating hypoactive sexual desire disorder. We're a little behind in all the treatments for men. We have one called Addie for premenopausal women. We're actually doing a trial right now at university hospitals for postmenopausal women with hypoactive sexual desire disorder. So we're looking for treatments for them as well. So it is an undertreated, under-recognized condition, and women really should not have to suffer.
All right, Dr. Kingsberg, thank you so much for joining us and for all of that insight for a lot of people who had no idea what this condition was. Thank you.